Hello and welcome. Today, we're diving deep into a rare but serious eye condition called Posterior Ischemic Optic Neuropathy, or PION. We'll explore what PION is, what causes it, how it affects your vision, and what can be done about it. This information is intended for educational purposes and should not substitute professional medical advice. If you suspect you have PION, please consult with an eye care specialist immediately. PION, at its core, arises from a lack of adequate blood supply to the optic nerve behind the optic disc, the part of the nerve we can see during an eye exam. The posterior, in the name, is crucial because it distinguishes it from anterior ischemic optic neuropathy, which affects the front part of the optic nerve. The causes of this blood flow disruption are varied. Systemic conditions like hypotension, particularly during surgery or illness, can be a significant factor. This is often referred to as perioperative PION. Other contributing factors can include anemia, which reduces the oxygen carrying capacity of the blood, certain vasculitic diseases, like giant cell arteritis, and even, rarely, conditions that cause increased pressure within the skull. Let's break down the pathophysiology, or how PION actually damages the optic nerve. When blood flow is reduced, the optic nerve cells, known as ganglion cells, don't receive enough oxygen and nutrients. This lack of oxygen, called ischemia, leads to cellular dysfunction and, eventually, cell death. The nerve fibers that carry visual information from the retina to the brain become damaged. The severity of the damage depends on the duration and degree of the ischemic event. Because the damage occurs behind the visible optic disc, early changes are often not immediately apparent during a routine eye exam, making timely diagnosis more challenging. PION is a relatively rare condition, making precise epidemiological data somewhat limited. It's generally understood to be less common than anterior ischemic optic neuropathy. While it can occur in people of any age, it's more frequently seen in older adults, especially those with pre-existing vascular risk factors like high blood pressure, diabetes, or heart disease. The incidence of perioperative PION, which is PION occurring after surgery, is extremely low, but it is a known risk, especially after prolonged surgeries in the prone position, such as certain spinal procedures. The signs and symptoms of PION can vary, but the most common and noticeable symptom is a sudden, painless loss of vision. This loss can range from mild blurring or dimming of vision to severe vision loss in one or both eyes. Other possible symptoms include visual field defects, meaning that part of your field of vision may be missing or distorted. Some individuals might also experience changes in their color vision, such as a reduced ability to distinguish between certain colors. Importantly, there's usually no pain associated with PION, which helps differentiate it from other optic nerve conditions. Diagnosing PION can be challenging because the optic disc often appears normal, especially in the early stages. The diagnosis usually involves a thorough eye exam, including visual acuity testing, visual field testing, and pupillary response testing. Optical coherence tomography, or OCT, can be helpful in assessing the thickness of the retinal nerve fiber layer, which may show thinning in later stages. Magnetic resonance imaging, or MRI, of the brain and orbits may be performed to rule out other conditions, such as tumors or compression of the optic nerve. Blood tests are also often performed to evaluate for underlying systemic conditions such as vasculitis or anemia. While there aren't strict, universally accepted classifications for PION, it's often categorized based on the underlying cause. We have perioperative PION, which occurs after surgery. Then there's arteritic PION, which is caused by inflammation of the blood vessels, such as in giant cell arteritis. Finally, we have non-arteritic PION, where the cause isn't directly related to inflammation but rather to other factors affecting blood flow. Unfortunately, there's no proven cure for PION. Treatment and management focus on identifying and addressing the underlying cause, if possible. For example, if giant cell arteritis is suspected, prompt treatment with high-dose corticosteroids is crucial to prevent further vision loss. For perioperative PION, optimizing blood oxygen levels during and after surgery is paramount. In all cases, managing vascular risk factors like high blood pressure, diabetes, and high cholesterol is critical. Low vision rehabilitation may be helpful to maximize remaining vision and improve quality of life. Preventing PION is often about managing the risk factors we've already discussed. Maintaining healthy blood pressure, controlling diabetes, and avoiding smoking are all important steps. For individuals undergoing surgery, especially prolonged procedures, careful monitoring of blood pressure and oxygen levels is essential. Discussing potential risks with your surgeon and anesthesiologist before any procedure is crucial. While PION is rare, understanding your risk factors can empower you to take proactive steps. The prognosis for PION varies depending on the severity of the initial vision loss and the underlying cause. Some individuals may experience partial recovery of vision, while others may have permanent vision loss. Early diagnosis and treatment of underlying conditions can improve the chances of a better outcome. Recent research is exploring potential neuroprotective agents that might help protect the optic nerve from further damage after an ischemic event. While these are still in the experimental stages, they offer hope for future treatments. Ongoing research also focuses on better understanding the pathophysiology of PION to develop more targeted therapies. Stay informed and work closely with your eye care professional for the best possible management of this complex condition.